2018, the Academy of Neonatal Nursing established a Neonatal Nursing Hall of Fame with the purpose of preserving the history of neonatal nursing and highlighting the contributions of our many nursing pioneers. Inductees considered for the Hall of Fame are neonatal nurses who have demonstrated a lifelong commitment to nursing, influenced the path of the profession, and made a significant or lasting contribution to the nursing care or health outcome of newborns. This year, Anne proudly inducts Kris Karlsen into the Neonatal Nursing Hall of Fame. Dr. Karlsen has spent more than 40 years shaping the way neonatal teams care for their most vulnerable patients. As a board-certified neonatal nurse practitioner, educator, and innovator, Kris is best known as the author and founder of the STABLE program, which is now the most widely used neonatal stabilization curriculum in the world. What began as her vision to make early newborn care safer and more consistent has grown into a global standard embraced by clinicians in more than 60 countries. Kris began her nursing career in New Hampshire before finding her home in the NICU at St. Mary's Hospital in Grand Junction, Colorado. There she joined the neonatal transport team and started her work as an outreach educator. The first edition of STABLE, released in 1984, was a 6-page handout she distributed throughout the region. Later, Kris went on to earn her master's and PhD in nursing from the University of Utah, producing influential research on neonatal transport and strengthening the evidence base for the STABLE curriculum. In 1996, while on bed rest with her second daughter, she completed the instructor training and founded the STABLE organization. Kris later specialized in caring for infants with complex congenital heart disease at Intermountain Healthcare and co-facilitated neonatal simulation education at Primary Children's Hospital. Throughout her career, Kris has blended deep clinical expertise with a gift for teaching. Her ability to explain complex physiology in a clear, practical, and compassionate way has made her a trusted mentor to countless nurses, NNPs, and transport teams. Her contributions have earned numerous honors, including induction as a Fellow of the American Academy of Nursing. Dr. Karlsen continues to champion excellence in neonatal stabilization through global education, conference presentations, and dedicated stewardship. As a lifelong learner and collaborator, she works closely with neonatal and obstetric experts to ensure STABLE remains evidence-based, relevant, and accessible.
So many babies who might not have been here today are here today because you provided education that empowered nurses and other caregivers to intervene quickly with evidence-based practices that improved the outcomes of newborns. Thank you for your devotion, your commitment, your unwavering advocacy for nurses and newborns everywhere. It's an honor to know you and to call you a dear friend. Enjoy this day of celebration today and recognition. You're so very deserving of it, Kris.
Think about a career that's been more than 40 years like mine. There have been so many things that have happened along the way that have inspired me to have people believe in you, to have them say things like, you should publish this. I remember that one of my very early memories of a family interaction was when I was a pretty new NICU nurse and a family that had to say goodbye to their 32-weeker. And I had taken care of this little baby, through her 2-week journey in the NICU. And that family wrote a letter to Sister Mary Eloise, who was working at the Sisters of Charity Hospital in Grand Junction, Colorado. And one of the things that they wrote in there about their experience in our NICU was that Kris Antonelli was the silver lining in our very dark cloud, because she did these things with our baby. And those things I did with their baby and for their baby, I did them as part of my nursing care. But for them, that was incredibly memorable. That it gave them hope. It gave them, I get kind of choked up when I think about it. But for me, I learned very early on the power of what we do at the bedside, that we don't know always that it's seen, but we have to always remember that it is. And so that I carried forward with me as I took care of families and tried to listen to them, tried to support them. and tried to give these babies the care that they needed despite how hard our job is.
I met Kris in 1999 when I started working with her on the Stable program. And what Kris brought to it provided me or gave me this opportunity to look at neonatal care through a new lens. It was this hyper focus on evidence-based practice. Like, what are the things that we need to do to enable, to anticipate problems that are going to occur with newborn infants and to intervene with them before they become a problem? And how do we address them in the best way to provide the best outcomes?
It is a true honor to recognize you, my dear friend, Kris Karlsen, for this Lifetime Achievement Award. I have been extremely fortunate for many decades to have worked closely with you at the bedside of critically ill neonates, as SimLab co-facilitators, and while teaching cardiac stable. Your career has been nothing short of extraordinary. I watched you take your inspired vision for improving the care of newborn babies to a level not seen in our nursing era. Your meticulous attention to detail and unwavering dedication has set a new gold standard for training in neonatal care. Kris, your legacy is lasting, your influence immeasurable, and your example inspiring. I am one of your proudest fans. Congratulations on this incredible honor, dear friend.
I cannot think of a more deserving recipient for this prestigious recognition. Kris deserves it. Her commitment to nursing and to the babies and families that we all serve should be an inspiration to all of us. Congratulations, Kris. I am so proud of you and for you.
But I've always felt a personal sense of purpose, that I can show up for my families in a positive way to educate them and listen to them and help them navigate a journey for which many of them have never been on. And so I encourage anyone hearing this to remain hopeful and remember why you chose nursing and why you chose NICU nursing, and to know that what you do is so meaningful and so important. And I implore people to find a way forward to stay positive and to also support those around you. It's reaching out to friends, helping those who struggle, supporting those who make an error or a mistake or have a near miss. People live with that. I've lived with that. And how did I get through it? I was supported through it. So I feel like those are some of the challenges that we have today. There are many more. People are probably running this through their mind going, well, what about this? Yes, if that's a challenge to you, it's a challenge.
Congratulations, Kris.